Welcome to Concussion, the podcast that dives deep into the world of brain trauma, breakthrough treatments, and inspiring recovery stories.
I'm Abby.
I'm Travis. 9 years ago, I crashed my motorcycle. I was going about 130 miles an hour on a motorcycle racetrack. Don't worry, police. And suffered a traumatic brain injury, definitely a concussion, and all kinds of other little issues that we've been talking about here and trying to help people get through that specific instance when they might not have the information that we have now that we wish we had back then.
And I'm a physical therapist, and Travis and I first crossed paths shortly after his accident, and neither Travis or I realized what we were missing at the time, which would be comprehensive and appropriate concussion intervention, which really could have made a difference in what he had to navigate in the years following. And then crossed paths later on, put our heads together, realizing that what we didn't know, likely other people don't know. So we have been working to try to find a good way to translate some of that, a context that would fit someone who's had a concussion, someone who's got a family member who's had one, a teacher, a coach, someone who works in the medical field, just to make it as approachable and familiar as possible.
Yeah, we're good, fun-loving people, and we want to try to convey all the things that we know in both medically astute and profound way, and something that most normal people can understand that don't have time to have medical degrees. That's the main goal, to bridge the gap between medical excellence and just normal everyday people.
So even in our pursuit of finding ways to make this more tangible, easier to understand for everybody, we also are realizing the fact that the brain is probably the most resilient part of our body. It has the capacity to learn, rewire, adapt in many different ways. So as Travis and I are starting this real-time conversation about what could have been done, we're also doing the things that we think would be helpful for you even where you are now. Specifically with driving, impulse control, the things that he still notices this far out from his traumatic brain injury. Recently, one of the times that we met up to do some things, part of the time we were together, I asked him to stand on one leg. And standing on one leg seems pretty simple. Just shift your weight, lift the other leg up.
Yeah.
And then I asked you to close your eyes.
Yeah.
And it all changed. Something that seemed pretty simple all of a sudden became very complicated and very frustrating.
Yeah.
Right? So what was your experience like with just...
So I remember my left leg wasn't too bad, but when I was doing my right leg, that was just, I could not get it at all. I thought that, that's something that sounds easy, just stand on your right leg, put your left foot up a little bit, close your eyes. And it doesn't sound real hard, but I found it incredibly difficult. And then you did a couple tweaks.
A couple different things to kind of activate the area of the brain that we needed to be more responsive. But let's take one step back here. After a concussion, noticing that your balance is off.
Yeah.
We've heard that from people who've been on the show with us, explaining their experience with a concussion. And I can say that out of the vast variety of symptoms that come after a concussion, balance impairment is probably one of the top 3 consistently.
Okay.
So it's very common to have this trouble with doing something that simple. Stand on one leg, close your eyes. Should be able to do it no problem. In fact, even just standing with one foot in front of the other and closing your eyes is pretty difficult too after a concussion.
Like
tandem?
Like the tandem axle gait, or what is it called?
Travis did some research before this. So
the sobriety test.
The sobriety test. Oh, I got you. Yeah.
Sobriety. That's the word I was looking for. And I am sober right now. Sobriety test. Yeah.
That's a great example. So in a sobriety test, they're trying to see if there's some sort of impairment, right? Yeah. Now, obviously, it'd be alcohol or drug induced, but the way that they try to elicit that impairment is in some ways a way that we try to also elicit impairment. So a cop would have you follow their pen with your eyes.
Right. Yeah. I've actually never had a sobriety test.
Me neither. Let's knock on wood somewhere, because that's something you don't want to speak into existence.
Right. Yeah,
but
we're not.
But the components of the sobriety test, just even if you had a familiar sense of this from watching movies, which I have not.
Abby has seen 2 movies her entire life.
I've seen more than 2. There's just 2 that I could think of. And did you notice that the 2 that I could think of were based on historical events?
I did.
So they were documentary style
movies. Yes, you love documentaries.
And even the movie I want to watch is a documentary style movie that I'm really frustrated I can't find.
I don't think I don't think they made it.
They made it. It was in the film festival.
I think it got canceled.
How do they have a trailer if they never made a movie?
I think that maybe it just got never. Maybe they just made the trailer.
No, why would you put through all that money to make your scenes, get your actors, and have those clips to make a trailer, but not have the movie?
I couldn't find it anywhere. What is it called? The long run?
The final run.
The final run. You know, Anne said that she's seen that. She was like, she didn't see it, but she's like, oh, I've heard of that. And I'm thinking like, no.
Sometimes she will subconsciously take my side.
Yeah.
Without even knowing that I had anything to do with it.
So I gotcha.
That's probably why she said that she's heard of it before. I have never met anyone who's seen it aside from somebody that knows it was made. So it was down in that area of South Carolina, and a guy was telling us about the history of the area and all of the true crime that's happened there with political figures being involved. And ironically, there's now like a TV series on Netflix about that same type of thing, just not that same area and the same circumstances that the movie The Final Run is about. So anyway, if anyone out there knows where to find that.
The Final Run.
Yeah, it's not about gambling. It's about the inner shore of like Hilton Head area in South Carolina and the drug smuggling that was coming in on the boats in that area. Yeah.
Nice.
So anyway, got off track. In other movies, they've done sobriety tests.
Okay, sobriety tests.
Maybe they do it in that movie too, since it does involve drugs.
Okay.
So the police officer will have somebody follow their pen with their eyes. We understand why that's important, to understand if there's anything influencing the brain or impairing. They will ask them to do what you said, 1 foot in front of the other, and they'll probably make them walk 1 foot in front of the other, like as if they're on a tightrope.
Yeah.
They'll ask them to count backwards from 50 by 7s. Now, if they really wanted to get high level, they could have that person walk heel to toe down a line and count backwards by 7s.
Yeah,
that's a dual task.
I would say, officer, I couldn't even do that sober.
Yeah, and you'd be honest about that. If you've had a concussion, the science shows that that's a very hard thing to do.
Yeah, and they do. I believe cops do ask that. Do you have anything that would like cause you to fail this that is not alcohol related? Like, do you have any type of cognitive disorder? Do you have any type of like brain disorder?
Yeah, any injuries that would have compromised your ability to do this.
And we now know that a concussion will.
Yes, look at us. Yeah.
Yeah.
Don't get in that situation.
Yeah, don't get in that situation. Look, do not be getting a sobriety test and saying, well, Travis and Abby said that I got a concussion, so I don't have to do it.
I am exempt.
Yeah, no.
Yeah. So that concept does carry over as to what they're looking for with a sobriety test, any evidence of impairment or slower reaction time. But on the concussion side, like I said, across the board. So for the years that I've been treating concussions, it's hard to think of the circumstances in which balance was not affected. It does happen. It can happen, but it's not that common. So it's more commonly the case that balance is affected.
Gotcha.
So to help dive into that a little bit, we have a brain model with us today.
And I'm so excited about this. Like, this is
awesome. Our guy. And the neat part about our guy is the skull comes off so we can see the brain inside. So this helps give us a visual of what can happen and why it would affect your balance. So the common mechanisms behind a concussion can involve the head going forward and back, rotational. You mentioned that last time that sometimes there doesn't even have to be a direct hit to the head. It just can be a rotational force, and the brain moves within the skull. And the injury to the brain or the swelling or the shearing forces can come from how the brain is moving within the skull. And
so a lot of people don't know. I was talking to somebody today, and he was under the impression that the the brain was always kind of pressed right up against the skull. So there was no gap in between, but there is a gap in between the brain and the skull. And when you come to a sudden stop, then the brain, due to laws of, motion, it keeps going forward. And when it does, it hits against the kind of bounces around in there.
Yep. And then the brain has connections all over the place, but there's one area in particular that likely is affected by exertional forces, or the inertial forces of the brain moving within the skull. And that could affect your balance. So there are 3 systems that we have that influence our balance. The first one's vision. So with your eyes open, you can immediately orient to the horizon and keep yourself oriented towards where the middle is to help keep your body in midline. The second thing is your vestibular system. So your vestibular system is very deep in your inner ears. It's kind of the deepest structure of your brain in each direction. And it has a series of canals that are responsible for detecting motion in relationship to gravity. So those canals have these little crystals hanging in them. And the best way to explain them is a minivan with a balloon that's hanging from the ceiling.
Okay.
Okay, so you're in the minivan, you see a string and then the balloon there. If the van speeds up, the balloon's going to swing back.
Yeah, I can see that happening.
The van turns right, the balloon is going to swing left.
Gotcha.
Okay, so there's always a reaction of where those crystals are based on movement and acceleration and where your head is, or the minivan in this case, in relationship to gravity.
Okay.
So even if the van were to just tilt in space, that balloon would move.
Gotcha.
And those crystals or the balloon have a responsibility to trigger hair cells within the canals that tells the body where the movement's occurring. So if you are, let's say, moving forward in a car and you close your eyes, so vision is no longer a part of this equation. If you're seated and you start to experience that forward acceleration, all the muscles on the front of your body are going to start to contract to hold your posture still so that you don't fall back as you move forward.
Okay.
If you're in that same van, you start to turn right. Have you ever seen when you're sitting at a traffic light and there's traffic turning in the opposite direction, every single person tilts their head with the turn?
So I haven't noticed that, but
Now you will.
now I'll check it out.
So if it's like at a traffic light and traffic from the opposite direction is turning towards you or away from you, you're going to start to notice everyone's head starts to tilt towards the turn.
I will have to pay attention to that.
So again, if vision weren't a part of that and there was just the acceleration and change in gravity, your body starts to contract muscles to help hold yourself in anticipation of that change in position.
Okay.
All that happens through your vestibular system.
So you don't even really know it.
Right.
It's just subconscious.
Exactly.
So your vestibular system is subconsciously keeping you oriented to the world.
Yep. So even without vision, you still have some sort of appreciation as to where the horizon is or where midline is.
Gotcha. Is that why when people get into a boat and it's like rocky and kind of weird feeling, that it's harder, the vestibular system, it kind of throws it off a little bit, and that's where seasickness comes from?
Yeah. And then sometimes if your vestibular system is stimulated continuously in that way and you step off the boat, you still have that sway.
Yes.
Yeah. There are some conditions where that sensation can continue on for months or even years.
Oh gosh, that would be
It's horrible.
So
It's called mal d'embarquement. It's a horrendous sensation. But anyway, that's the vestibular system has been stimulated in such a way that it keeps up this perpetual sensation of motion. But that was the exact example that you gave, that your vestibular system is the one that's responsible for making those accommodations when you're on a boat, because your head senses that you're moving and then lets your muscles contract to keep yourself upright.
Gotcha.
And then the third system that contributes to our balance is our proprioception.
Proprioception.
And we talked about this one time before.
We did. From the book by Oliver Sacks. That's his name.
The man who mistook his wife for a hat.
You got it.
Yeah.
Got it, man.
So proprioception is all this nerve information that comes up from your body. So from your hands, knees, every trunk, everything. It sends up nerve information about muscle tension, joint position, And then that helps you understand where your body is and what changes you would need to make in your posture. Okay, so we have 3 systems that contribute to your stability: vision, vestibular, and proprioception.
Gotcha.
So you brought up last night something that we tried when we were together. So you had the job of standing on one leg, and you did that with your eyes open. It was a little bit challenging with your eyes open, but definitely doable.
Mhm.
And then I had you close your eyes, and it got much harder. So eliciting that condition of eyes open versus eyes closed, that's considered a Romberg test.
Romberg. We talked about this last night.
We did. So Dr. Romberg was the one that kind of explained this phenomenon. If we have 3 systems that contribute to your balance and stability, we have vision, proprioception, and your vestibular system. How do we know which system is off if your balance is off?
That's like the 3-body problem.
3-body problem? What's
That's
that?
like the 3-body problem. That's way out of the realm of this podcast.
Okay.
That is like this. So, but it's actually the same thing. Now that you say that, if you have 3 bodies in space floating around, you can't really tell which one is causing them to rotate around each other or something like that. Something to that. Like, it's advanced stuff.
Okay, so it sounds like physics.
It is. It's physics.
So if we know somebody's balance is off, or even if they're telling us their balance is off, how do you figure out what system you need to train? Do you need to train their vision? Is there a problem with their vestibular system, or is it a problem with their proprioception?
Good question.
So Dr. Romberg's contribution is put somebody in any position. So this is the part that often gets confused on the healthcare side. People will list it as like Romberg stance or Romberg position or Romberg test, and they'll assume it's just the condition of feet together, eyes open, eyes closed. But it's the condition of eyes open, eyes closed that makes it a Romberg test.
Okay, the condition of eyes open and eyes. So I got you.
So if there's a discrepancy, let's say for instance somebody can stand in tandem, one foot in front of the other, and they can hold that position perfectly fine with their eyes open, and then you ask them to close their eyes, and then their posture goes all over the place and they can't hold their balance there. That's considered a Romberg test. The experience you had was on one leg. So you stood on just your right leg, had your eyes open, stabilized yourself there, closed your eyes, became much more challenging, and then it was your left side that was significantly harder. Your right side was significantly harder. Okay. So did it on both sides, but the Romberg test revealed that when your eyes were closed on the right side, it compromised your balance.
Yes.
So we know that vision is working well. Once we eliminate vision, we then have a problem with either proprioception or vestibular function.
Okay, so
now
process of elimination.
Now, we explained that the vestibular system is mostly active, or almost exclusively active, when you're in motion.
Gotcha.
So if you're still and you perform that test of eyes open, eyes closed, and there's a difference with eyes closed, but you're still, that would leave us with proprioception.
Gotcha.
So all to say that balance after a concussion is very challenging, most often due to proprioception. Occasionally there's some vestibular insult. So it does happen. I'd say I'd have to look up the exact metric. It's between maybe 5 to 15% of concussions have a vestibular insult as well. But that's a different animal. That's when they get the sensation that they're spinning, unable to stabilize themselves when they're in motion. And that requires a more direct intervention to the vestibular system.
Yeah. I remember one of the big problems I had is when the first, I would say probably 5 months after, and honestly, I don't remember if this happened when I was coming to see you, and it might have been, and I just might not have, it might not have been that bad, but it seemed to get progressively worse. Every time I stood up from a sitting position, everything would spin, and I would be like this, like
fast or slow?
Fast.
Oh, yeah, you did have a vestibular insult.
Yeah, and there was times like twice I pretty much fell down because it was I just couldn't.
It was that disorienting.
You
didn't have any lightheadedness?
No lightheadedness. It was just like spinning.
Okay.
And once I kind of like just grab something and it would stop.
Mhm.
And I'll be like, all right, I'm good now. But that every time I got up.
Yeah. So did you get that same sensation if you rolled over to get out of bed?
Yes.
Yeah.
So
you did have a vestibular issue. Did anybody help you with that?
No.
All right. Well, thankfully you happened to move in the correct series of head movements to clear the crystal that was loose.
So what I did was like, it got to the point where it was like, so every time I would get up, it started to become dangerous and I didn't know what to do. So I just like literally typed that in YouTube or on Google or something. It was like, every time I get up, the room is starting to spin. And this guy on there is like, well, you have to like get on your knees and you have to look down and look back up at the ceiling and this series of head movements. And I'm like, there's no way that this is going to work. I was like, this is like debilitating to me. Like, there's no way just me like turning my head certain way is going to fix it. And like it did. It fixed it. And
So the vestibular issue that you're explaining, like that fast spinning when you change your head position in relation to gravity. So it's got a complicated name of benign paroxysmal positional vertigo, BPPVs, people call it. The only way to treat it is through positional maneuvers.
yeah.
So you
that
came
works.
across the right YouTube channel. The trouble is that the movements are so specific. If you don't follow it exactly, it's going to make you more dizzy.
Yeah.
Like
It
you have to be
was-
really attentive to what you're doing.
Yeah. And I paid very close attention. Like I was to the point that I was so happy when that worked. Like I was like wanted to cry. Like I was like, I cannot believe this is fixed. Like
Mhm.
this has been plaguing me for months. Like it was bad to the point where like it was affecting my life.
Yeah. It is incredibly disruptive.
Yeah, it was really bad. So, but that fixed it, and I did it. I had to do it a couple times, and then I say a few like a couple weeks later, it started to come back, and I did that exact same thing again, and it went away, and it's never came back.
Good. So even without a head impact, someone can have that happen to them. So they can just wake up one day and experience that. And it's
Without it,
horribly debilitating.
yeah, it's terrible.
And oftentimes they actually go to the emergency room because they think they're having a stroke or something terrible's happened because it's that terrible of a sensation.
Yeah. So my a friend of mine at work was having that same sensation, and me not knowing anything, I was like, "Oh man, your crystals, you got to align your crystals, dude."
Align them.
And like he tried what I had said, but then he went back and he went to like the cardiologist, and he had to end up having like a quadruple bypass. Yeah, like his was all heart related.
Yeah, that can happen too. Sometimes they can just have AFib.
Yeah.
Yeah. There's a lot of, you want to rule other things out when that happens, but it can be from an inner ear dysfunction. But yeah, you certainly want to rule out all the other things. And a lot of times people are just experiencing the slow spin when they go from laying down to sitting or sitting to standing up. And their doctor will send them to us in therapy and say, hey, they need a positional maneuver. But it really just turns out they need to drink more water or lower their blood pressure dose because that slow spin is something totally different.
Gotcha. Yeah, mine was like fast spinning, like like down I go.
So one of those crystals that was previously attached to the top of the minivan,
Fan, the balloon.
Yep, it's no longer attached. So it's free floating in that minivan. It can slide back and forth at any point. So since it's sliding back and forth at any point, it's triggering all those hair cells in that canal to tell your body you're on a roller coaster.
Wow.
Because normally if you're just getting up, it's a little bit of just a boop, little swing. Tells the hair cells that your body's getting up, make accommodations. But instead, it's being told that you're moving at like 80 miles per hour. You better brace yourself. So your eyes will start moving in anticipation of moving that fast. And then you get a lot of horrible sensations that accompany it. Sometimes nausea, vomiting, all that can be very unpleasant. So within that, slowly dissecting out where the balance issue can come from, landing on proprioception, that is a system that definitely has to be trained after concussion. So that way you're more stable on your feet and you can process information from your environment a lot faster. So the area of the brain that has a lot to do with movement quality is actually back here in the cerebellum. So this model was kind enough to make the cerebellum a different color just to make it a little bit easier to see.
It's green.
Yep. And even allows us to separate the brain into hemispheres and then see the cerebellum there. So the cerebellum is relatively small compared to the rest of the brain, but it is mighty.
Okay.
So not only does it help tremendously with our balance, it also can help modulate how much force muscles will put into certain movements based on the information that it perceives. So it can affect our ability to react to changes in environment or standing on one leg. And it can also help us control how much force we need to be able to accomplish a certain task. So if you're going to open a door, it's your first time at this building, and you assume it's a very, very heavy door. So you put a lot of effort into it, and it swings back super fast. The changes that your cerebellum is making is once it realizes that that force is exceeding the amount necessary, it'll start to back off. That way you don't smack yourself in the face with the door.
Gotcha.
So that's the type of muscle contraction modulation it can perform.
So we've talked a few times about how athletes are 11 times more likely to sustain a lower body non-contact injury after a concussion. Is that in some relation to the cerebellum?
Yes. Yes, it is.
Okay.
Yeah. So if that cerebellum is responsible for making changes based on movement quality or movement force, then yes, that's going to have a lot to do with how they can cut, change direction, or decelerate themselves, change direction, or land from jumping. But yes, the cerebellum has a lot to do with that. Something else that's important to notice about balance is, do you remember when you were standing on one leg and I told you if your ankle is moving around a lot, that's perfectly
good.
fine?
Yes, I do remember that.
But if your trunk is moving, so if it looks like you're taking a bow or bending to the side to dodge something, that's the part we wanted to clean up.
Yes, I do remember that.
So if someone is losing their balance from their trunk position, oftentimes we want to look a little bit closer at the cerebellum. Now, another way to explain that, you were sent to physical therapy for your ankles.
Yes.
Now, I was not a great concussion therapist back then, but I know for certain that even at that point in my career, if someone was coming to me for any sort of situation with their ankles, I had them practice standing on one leg. So you did have that exposure after your brain injury to try to restore that function, standing on one leg. And here we are years later, and it's very difficult for you. So just the idea of practicing standing on one leg is not going to perfect the system. We have to do something that helps engage the cerebellum to make that process of standing on one leg, especially with your eyes closed, much more successful. So we did things together to help engage your trunk muscles, make your body a lot more attentive to the changes it was experiencing, and all that could help improve your single leg balance.
Yeah, and it did, and I was pretty impressed with that. And I can't remember what it was. Like you moved my arm over or something like that.
So I gave you a resistance band.
Resistance band, yep. Okay, yep.
And I had you move it in diagonals. The reason for that is because I wanted you to be attentive to how much force you were using to move it.
Okay.
The shape that your arms were taking, and then I had you repeat that with your eyes closed. So we're just enhancing how much this area of the brain would have to pay attention to the movement quality and what was happening in your trunk. And then we got better movement.
You're so smart. That's awesome. That worked. It did work. I was very impressed with that. Like I was like, whoa, that's like as cool as the carrot thing to me.
The carrot thing?
777 or 1 + 1.
Oh, yeah. So here's the thing. So I tried that at work the next day, but I didn't do it correctly because I went higher in the numbers. And also I work with a group of people who insist on being the outside thinker.
Yeah.
You know, if you want them to do something or say something, they sense it and they will they have oppositional defiant disorder, all of them.
I gotcha.
Yeah. So the people that didn't said carrot. The people that did not.
So I got another one. Really, really fast.
Okay.
And it'll be the same kind of. You didn't see that, did you? Okay.
No.
So we'll go the same way. What is 1 + 1?
2.
2 + 2.
4.
4 + 4.
8.
8 + 8.
16.
Name a
drill.
Okay.
I heard you start to say hammer.
I know.
I couldn't
know.
do it. I couldn't do it.
I know.
I guess I have oppositional defiant disorder too.
You do, Abby. You do.
That's why I said zucchini the first time.
You do. And you want to see that movie that's never been made.
It's been made. How are they going to
Abby
go through all that trouble to get a trailer together with all the scenes from the movie?
Oppositional disorder.
Yeah.
All right.
Yeah. So anyway, that so when I explained that at work, someone gave me a different version. That was a series of multiple questions, and it was to make you end up at a certain description of what the riddle, I guess you would call it, is after. But that one wasn't as good because from the beginning, it set you up on a path to all end up at the same number, even though it told you that you could pick any letter between, I think it was between A and E or something like that. But that's a long tangent for another time. But anyway, this area of the brain here,
cerebellum,
is essentially our pilot for movement execution. But as we can see in the skull, it's also likely the most susceptible to experience some sort of damage from shearing forces or from swelling or just the movement in the skull, because the cerebellum is tucked right down in here where the skull becomes much more narrow. So it comes down into an area where it starts to feed into the spinal cord. Actually, the brainstem here is the start of the spinal cord. So when that's tucked in there, nestled all nice, you can see through the bottom that that's going to be where our spinal cord comes through, right down in there.
That's the brainstem?
That is the brainstem there. Yep.
Quick side note. Yeah. I was talking to my friend about this today, and another person that was in the room, besides the guy who didn't know that the brain there was space in between the skull and the brain, he says, and that's why there's sometimes there's a condition known as internal decapitation, where the brainstem
severs on here,
separates from the spinal cord.
Oh,
yeah.
Really?
I guess.
Got to be moving pretty quick, but I guess, I mean, that could certainly happen mechanically. Like, that makes sense in terms of where that small little outlet is from the bony formation of the skull, and then where the brainstem comes through there. Huh. I've never heard of that condition, but then again, they wouldn't be here to tell about it, so
yeah,
you're not going to hear about it as much.
Right.
Internal decapitation. Wow.
I don't want that to happen.
No. But anyway, I think this skull model here is going to be a good resource for us.
Yeah, I'm very much into that. Things.
Now, we're still hiring for a Jello cook.
Yeah, still looking for Jello cook.
So that way we can put our own brain in here and show some different mechanics.
So I remember when I took anatomy and physiology, I had to name each one of those
fissures.
Yep, and like the sections of the skull and all, and then this, because this is a joint, kind of like a.
So it's not fused until I think 2 years old.
Right.
Yeah. So until then, it's a lot more malleable. But I think once they fuse, they're relatively it's set for life.
Yeah. It does. It's like it's a joint, but it's a different. It's not like your finger joint, you know.
Yeah, not a movable joint.
Right. Yeah.
Yeah, because if any time they need to get through there, they have to cut through the skull. So those fissures form and stay very, very secure in that way. But yeah, this will be a great way to kind of show different areas of the brain and different consequences in concussion rehab that we would notice based on the area that experienced the most injury or the most bruising or shearing forces.
Yeah.
Yeah. So.
And then this is obviously the frontal lobe, frontal lobe. So that's like emotional stuff, and exactly. We're going to talk about that in future episodes.
And then actually, we've talked about it beforehand. This might be a good way to show the white matter of the brain. So in this area here, we have the limbic system, which I think you've brought up a few times, but all the white matter is a different structural component. Like the neurons are a little bit different in the white matter versus the gray matter of the brain. So the gray matter of the brain is all this out here, but the white matter is very important to like our essential functions in the brainstem, especially controlling our body's regulation. So heart rate, breathing, all that kind of stuff.
Yeah.
Yep. All right. We slide that guy back in here. And then Travis and I need to reconvene again to do some more interventions.
Oh yeah. Yeah. I'm down.
Yeah, and I'm curious what his balance is going to be like when we meet again,
My goodness.
because it did improve quite a bit with
Oh.
just isolating that area.
Oh no. Now I feel like I have to outperform myself last time. I'm very competitive with myself.
How's driving been recently?
You know what? Today was pretty good.
Yeah?
Like I was very chill.
Good.
Whereas yesterday I was pretty like aggravated. I was pretty aggravated driving home yesterday. Today though, it was like I was pretty calm. And it wasn't that great of traffic either.
Yeah. And the balance side of it that we did, like the single leg balance, won't necessarily have a great tie over to driving, but it is an important function that we isolate and restore, so that way we're getting the most efficient communication between brain and body as possible, so that way everything else that we're working on will follow suit. And granted, we only tested his balance in a static position, meaning when he was still, but there are other ways to look at what your balance is like when you're moving, because that's a very important function too. Like, who cares if you can stand on one leg with your eyes closed if you can't walk with having your head turned, weave your feet in front and behind, or walk up and down steps without losing your balance.
Yeah. So I will have to show you when we're done here. And this weekend had me climb a ladder and cut down limbs of a tree, like pretty high. And I didn't have a chainsaw, so I had to just use it like
On a ladder?
on a ladder.
That's not safe.
It was the most unsafe thing I've ever seen, Abby.
She's reckless.
She's crazy.
So why did these limbs have to come down? Were they hitting the house?
No, they were disinhibiting garden growth. Her flowers were growing at in an angular momentum, an angular
Direction.
and
there?
she did not like that. She says, "I hate the way those flowers are growing."
So get on that ladder and saw down that branch.
And I did, and there was lots of branches. Did you see them out there?
No.
No, they must have picked them up today. Oh yeah, today's Tuesday.
Oh, okay.
I will show you all the massive. Yeah.
Wow. Angie put you in some compromising positions, but she has a beautiful garden to show for it. So
Yeah.
I guess it's only a problem when somebody gets hurt, and then she'll change it.
Maybe. Yeah.
Well, thank you all for joining us today, and we will see you all again next week.
Yeah, today, and we learned that the vestibular system was let's go over the three systems one more time. So you have the vision, vestibular, and proprioception.
Proprioception, you got it. Those are the three systems that contribute to your balance and stability.
Gotcha.
Yep. And
awesome.
Dr. Romberg found a way to figure out if it is vision, proprioception, or vestibular that is contributing to the balance dysfunction.
Thank you, Dr. Romberg.
Yes, thank you, sir.
Appreciate it.
And soon we'll hopefully discover where Dr. Proprioception is from.
Dr. Proprioception. The cool story about that, and
there's not actually Dr. Proprioception.
The man who mistook his wife for a hat. The lady who had this proprioception issue is her, when she wasn't looking visually, she wasn't connecting. She had to connect her vision to her hands, because her arms would go like this and it would be moving around, and she wouldn't know. And she would only know when she looked. She'd be like, "Oh, I'll move my hand again."
That's wild.
Yeah. And she couldn't feel her body. The only time that she could feel her body was when she was riding in a convertible with the top down. And she said she loved that because she could feel her whole body, where normal she just felt
a lot of sensory input.
Yeah, that was missing.
Yeah.
So yeah, very, very good book. The Man Who Mistook His Wife for a Hat by Oliver Sacks.
And you're reading another good book now, aren't you?
I am.
Excited for you to finish this so we can discuss it.
Shaken Brain, and this is why the movie thing came up in the beginning. In the very beginning of this book, Shaken Brain, they depict Dorothy and the Wizard of Oz. And I said, "Isn't that cool, Abby? Have you ever seen Dorothy? Have you ever seen the Wizard of Oz?"
I have not.
I cannot believe that. Me and Ange were talking about that. We were saying, like, what?
I mean, do you remember sitting down and watching that movie?
What? The Wizard of Oz? Yes.
Really?
Yes. I used to watch that like all the time when I was a kid. Like, I was scared of the witch.
Really?
Wicked Witch. You don't remember the Wicked Witch?
No, I didn't see it. I just remember all the references of the Yellow Brick Road, Toto, the Red Shoes, that
The
kind of thing.
Ruby.
Like, I think I'm mostly familiar with Wizard of Oz from people's Halloween costumes.
Abby said the red shoes.
Isn't that what they're?
The ruby slippers.
Rubies. Well, the kids wearing them as part of their Halloween costume, the red shoes.
Oh, Ab, you have got to see it. I'm melting. No.
I mean, I've heard somebody say that. I didn't know where it was from, though. I mean, you got to make a list of, like, the top 2 movies of all time that you have to see. But don't make them ones that are going to give me bad dreams.
I know, you're a busy girl. You're a busy lady.
Yeah, but I'll watch a documentary, so you make time for
All
what's
right.
important. Yeah.
Okay.
All right. Thank you all for joining us, and we will see you again next week.
Yeah, thank you so much. See ya.